Today we're talking about filler. So most filler is comprised of hyaluronic acid, which is a sugar molecule we make in our body anyways. Super cool. It can hold 1,000 times its weight in water. One syringe of filler looks like this, and it's typically 1 ml, that's a volume measurement, or 1/5 of a teaspoon. So it's that much. And as the other video talked about, we can use filler to replace the appearance of bone loss. We can use it to mimic fat in our face or to draw in hydration and volume for our lips. The type of filler you put in your cheeks is different from the type of filler you put in your lips. Just think about where it's going. What's kind of the natural composition of the area? If I'm putting filler here on the bone, I want it to mimic a bone. I don't want it to get puffy. That means I don't want it to draw in a lot of water, and I want it to stay where I put it. I don't want it to spread. If I'm putting filler in the lips, I don't want it to be firm. I want it to spread, and I want it to be soft, and I do want it to pull in fluid or water because it's supposed to be hydrating. So they're hyaluronic acid kind of concoctions of filler to meet both needs. Where you place the filler, the depth at which you place it matters a lot. So if I'm mimicking bone, I need it to look like bone on animation, like talking and smiling, and at rest. Lips need to look good at rest and moving. We don't want to draw attention to it. So most fillers are hyaluronic acid, and they have a preservative called BDDE. Otherwise, if we injected this without the preservative, your body would break it down instantly. It just wouldn't last. And most fillers have powdered lidocaine in them as well. So how long do they last? Depends on the filler. Typically, lips last 12 to 18 months. Cheeks, chin, temples around 2 years. The more movement an area has, like laugh lines and lips, it tends to break down a little bit faster. Depends on your metabolism, depends on the actual filler also. So what can go wrong? The worst thing that can happen is filler can accidentally be injected into an artery, and arteries flow away from the heart, right? And it could cause necrosis, which is skin death. Filler could block an artery, and then the blood flow can't go past. That is worst case scenario. That is why you want to make sure that your injector has hyaluronidase, which is an enzyme that breaks down hyaluronic acid, in case it does happen. It's rare, but I've seen it. It's not fun. Usually you see it instantly. You could see it within 24 hours. So it's a good idea not to fly or be unreachable for the 24 hours following your filler. I have seen a delayed onset as well. What it would look like for the injector, when we're injecting, it usually looks like the skin turns gray, or just doesn't have a good cap refill. And what I mean by that is if you press on 2 areas of your cheek really firmly, let go, we want the whiteness or blanching, we want it to come back to your normal skin color 3 seconds or less. So the blood flow can just look sluggish. Sometimes it's not a blockage of the artery, it's a spasm of the vessels around it. They kind of are like something's going on, and it can mimic an occlusion. Occlusion's when the vessel's blocked. So how do you fix it? Heat, massage, injecting hyaluronidase. We have an ultrasound so we can pinpoint exactly where the blockage is, and you just repeat that process. The worst thing is to ignore it. Tissue death does take about 3 to 5 days on the bright side. This is something that you would absolutely notice the next day if there's a problem. Grayness, skin color changes, a lacy appearance. So that's the worst thing that can happen. We really don't know the incidence of it because many people do not report it. I don't inject noses, and I don't inject frown lines because those are much higher risk areas for blindness. There are people who do them. They look beautiful. I just like to sleep at night. I don't like risky things. So there's an artery that feeds the back of the eye, and there have been reported cases of blindness with that. But overall, filler is a really great procedure to replace volume. Bruising, asymmetrical swelling, discomfort is pretty common for a couple days, especially the lips. The lips are the most troublesome, like annoying after. So you go home with your lips look like huge, and then you have your significant other say something, and when you're already self-conscious about it, it can kind of not feel good. So we always like to say have your lips done if your significant other one is traveling, if they're going to be outspoken about it. So filler, choose a hyaluronic acid if you're doing it. Trust your injector on what filler they're choosing for where. Just because your best friend had a certain filler in your lips doesn't mean it's right for you. Everybody's anatomy is really different. Should last 1 to 2+ years. And I'm trying to think of what else. The needle's pretty small. It's not quite as small as a Botox needle, but it's pretty small. Depending on the area, topical numbing first or ice, little vibration for distraction. Most people say it's like, well, lips are the most painful, and that is, hopefully it shouldn't be over a 5 out of 10 discomfort. Most people, I'd say, are about a 3. The first time you get your lips done, that's always the most uncomfortable. Cheeks don't really hurt. You hear a crunching sound with the cheeks, though, like, I love it, but listen, I'm a weirdo. So the noise of the cheeks can be a little strange, but cheeks don't usually hurt. Temples are done with needle or cannula. That doesn't hurt. This chin shadow area, that's a sensitive one. So I like to do some injectable lidocaine before that guy. There are a lot of nerves there. But yeah, let me know what questions you have.